Every year, 7 million people worldwide suffer sudden cardiac arrest. It can happen to anyone, anywhere, at any time. 84% of sudden cardiac arrest events occur outside of a healthcare setting. Only 5 to 10% of victims currently survive. While some cardiac events are treatable with effective cardiopulmonary resuscitation or CPR alone, others require a combination of effective CPR and the use of an automated external defibrillator, or AED, to deliver a life-saving shock within the first few minutes of cardiac arrest. In both cases, effective CPR contributes to an increase of survival rates of up to 75%. HeartSign's CPR Rate Advisor, featured on certain models of the Samaritan PAD automated external defibrillators, provides real-time visible and audible feedback to the rescuer on the rate of CPR compressions during a sudden cardiac arrest. CPR is crucial to deliver oxygenated blood to the body's vital organs. CPR quality encompasses a variety of CPR parameters. Improvements in any of these parameters contribute to overall improvement in CPR quality. CPR Rate Advisor helps ensure the rescuer performs CPR at an effective rate and at an optimal CPR fraction, in line with the American Heart Association and European Resuscitation Council guidelines. With its revolutionary technology, HeartSign's CPR Rate Advisor uses only the defibrillator electrodes to detect changes in patient impedance rather than accelerometers or pucks, commonly used in other AED solutions that provide some CPR feedback. The changes in impedance are related to the rate of compressions. When a patient collapses and a rescuer performs CPR, the compressions applied by the rescuer cause the patient's chest to change shape. CPR Rate Advisor captures this change in an ICG waveform, which it uses to count the number of compressions a rescuer administers. When the rescuer compresses the patient's chest, the rate is reflected on the ICG waveform. The greater the rate, the greater the number of deflections. CPR Rate Advisor measures the change in impedance and uses this to determine the appropriate feedback to the rescuer, advising them of good speed, or to push faster or push slower. This real-time feedback is very important, as rescuer fatigue may set in after as little as 1 minute, resulting in slower compression rates. CPR fraction, the percentage of time that CPR is performed, is also an important parameter for CPR compressions. To help optimize CPR fraction, the SAM 450P uses the electrode pads to prompt the rescuer to begin CPR, and will continue to remind the rescuer to begin CPR when it detects that compressions have stalled. With its real-time visible and audible feedback to a rescuer, HeartSign's CPR Rate Advisor helps improve the quality of CPR compressions by improving compliance with CPR rate guidelines and optimizing CPR fraction by continually prompting the user to begin CPR. CPR Rate Advisor is integrated within industry-leading HeartSign defibrillators, so a shock can be delivered if needed. Effective CPR, provided alone or in conjunction with a life-saving shock, can dramatically increase the chance of survival. As the Samaritan PAD is a defibrillator specifically designed for public access, all HeartSign defibrillators can be used with minimal training in any environment. Integrated CPR Rate Advisor helps improve compliance with CPR rate and CPR fraction guidelines while instilling more confidence in the rescuer, both of which help improve survival rates.